Well, good afternoon. I want to give you a quick update on our latest efforts to manage the situation around COVID-19. As we continue to work through this difficult time together, my commitment to the people of Ontario is making sure you're being kept informed and up to date on the latest developments each and every single day. As I always want to thank our frontline workers in the fight against COVID-19, these people are the heroes. They're the ones working day and night to slow the spread of this virus. If you know a nurse or a doctor, cleaning staff at a facility, please reach out and thank them. A lot has happened around the world since I stood up here yesterday morning and declared a state of emergency. I want to thank everyone who followed the orders and who are doing their part to flatten the curve. Because practicing social distancing is one of the most important things we can do right now to slow the spread. Last night, I spoke with Deputy Prime Minister and U.S. Trade Representative Ambassador Lighthizer. We discussed their plans to close our border with the Americans. They have assured us that trade and commerce will continue. I know it was a tough decision, but it was the right decision. I spoke to the Prime Minister earlier this morning, and I told him he made the right decision on the border. I also told the Prime Minister that we're very pleased to see the federal government stepping up in a big way. My ministers and I have been in constant contact with our federal partners. We've been working hard to coordinate our response, not just in terms of immediate support to the health system, but also on the direct supports needed for businesses and people affected by the situation. We asked the federal government to implement immediate EI reforms and expand eligibility for workers and families impacted by COVID-19. We also asked Ottawa to provide certainty to businesses by establishing a loan program for those impacted by reduced hours and closures. And today, I want to thank the Prime Minister and his team for their announcement of $27 billion in direct financial relief for the people of Ontario and Canadians everywhere. These EI reforms, doubling the GST rebate, increasing the child care tax credit, providing relief to seniors. These new emergency programs will help families and workers, including those who are part-time and self-employed, along with $55 billion in tax deferrals. That will keep money in people's pockets and in the economy during this critical time. We expect these programs to provide relief as quickly as possible to Ontario and Canadian families and workers, especially those who are now without a job. The temporary business wage relief will also help small businesses, charities, nonprofits, and places of worship impacted by these closures. These are all necessary steps, and I thank the Prime Minister for his leadership. In Ontario, we are first and foremost taking all steps necessary to slow the spread of COVID-19, and at the same time, building capacity in the healthcare system. We're working hard to flatten the curve, and we're sparing no expense, starting with the initial $304 million of emergency relief package we announced yesterday, to add more hospital beds, conduct more screening and testing, including 24/7 screening of staff and visitors at long-term care homes. We're working to set up 25 dedicated assessment centres across the province to ease the pressure on hospitals. We've expanded our testing capacity. We're conducting 2,000 COVID-19 tests a day. We are on our way to being able to do 5,000 tests a day. Yesterday, I spoke about the ingenuity of Ontarians. I've heard from many businesses, many manufacturers. For instance, companies like Dillon's Distillery are showing the Ontario spirit we hold so dear. They're shifting their production of gin to making hand sanitizer and disinfectant and providing it for free to healthcare workers. I spoke to Cisco. I just got off the phone with the president of Cisco Canada, and one of the largest links in the restaurant supply chain, who are altering their deliveries to keep food on the shelves and in shelters. I've also heard from the Automotive Part Manufacturing Association. They've offered their support. Ontario factories have offered to alter their production. They have the tools to make important health equipment, and they're ready to help. My friends, this is the heart of the Ontario spirit. As more companies shift their production, these companies are putting the people of Ontario first, and I thank them for their support. I thank them for their ingenuity, and I thank them for exemplifying the Ontario spirit. The reality is, the issues we face today will not be the issues we face tomorrow. But we will remain vigilant. We will remain strong. And most of all, we will remain united. We are taking nothing for granted, and we will spare no expense to support Ontarians through this difficult time. Ontario is doing their part to provide relief to families and certainty to businesses, including the introduction of legislation tomorrow to provide job protective leave to workers with symptoms of COVID-19 or who have been asked to self-isolate, and to parents and guardians who need to take time off to take care of the children during school break year and daycare closures. I'm also looking forward to sharing more about the next stage in our emergency relief package, which will be part of Minister Phillips' spring economic statement and fiscal update next week. You will hear more from our team on these measures in the coming days. I will now turn it over to Minister Phillips to provide further update on steps we're taking to support the economy during this difficult time. I thank all Ontarians, and God bless you.
Thank you, Premier, and of course, I know myself and join the Premier and the Deputy Premier in thanking our frontline healthcare workers, as well thanking the staff that are cleaning not just the healthcare facilities, but also all of the other vital facilities. These are all the real heroes that we're here to support and that are helping us in this difficult time. It has been the last number of days. We have been in daily contact with Minister Morneau and his team in terms of the development of the package that the Prime Minister and the Minister of Finance presented earlier today. I'd like to join the Premier in commending the Prime Minister, and in particular Minister Morneau. I have to say that it's very collaborative in terms of the work that was done and has delivered, certainly in our government's opinion, on a package. It is a substantial package, and it is a package that addresses the issues that are front and center. Support for working people, support as well for some of the most vulnerable, whether our First Nations or homeless, and as in a timely basis. And we look forward to continuing to work with the federal government, with Minister Morneau and the rest of the government of Canada in terms of coordinating our approach. We will be, as the Premier mentioned, next Wednesday, we'll be coming forward with our economic and fiscal statement. This will be an opportunity for us to outline further supports. Part of the timing of that was to make sure that we had the opportunity to see what the federal government was doing. As I've talked about, our priorities will be, first and foremost, making sure that there's support for our healthcare system. It's a vital element of the fight against COVID-19 and something that we will make sure there are the resources to do. We also wanted to make sure that there was support for people and for jobs. And that's why, again, it is so helpful that the federal government has stepped forward with a significant package that particularly focuses on those that are directly affected. We will, as you would expect, be coordinating with the federal government. There was initiatives, for example, in the one item they mentioned, the extension of student loans in terms of a 6-month deferral. So we will be working with the government to make sure that we make life as easy for people who are affected by aligning some of these initiatives. And we're going to continue to collaborate with our federal partners and with other governments across the country to make sure that the supports that we're providing get where they need to get there quickly, and get there in the most efficient fashion possible. So I'll just wrap up by saying, again, I want to thank Minister Morneau and his whole team, and say that we look forward to standing shoulder to shoulder with the federal government to support Ontarians, to support Canadians through this difficult economic time. And with that, I think we'll be happy to take any questions.
So we'll take questions at the mic. One question, one follow-up. We'll start with the reporters on the floor here and then move to the phone line.
Hi, Premier. This is for all three of you. We're hearing from frontline healthcare workers who are returning from traveling abroad that they're being told to go to work and they're not being told to self-isolate. So can you comment on that?
Well, I'll pass that over to the Health Minister.
Thank you very much. The same holds true for frontline workers as for anyone else. They will be asked to self-isolate if they've traveled. We know that it's especially important for frontline healthcare workers because they're dealing with patients, some of whom may have COVID-19, some of whom have other more compromised conditions such as cancer. We want to make sure that we keep everyone safe and healthy, and so we will require healthcare workers to do the same as everyone else.
So making it mandatory?
Yes.
Whether
yes.
they're asymptomatic or not?
Yes.
Thank you.
Thank you.
My question's for the Premier.
Yes.
We're getting a lot of phone calls from construction workers wondering why they're not being sent home. They're on site, they're up in buckets, there's no social distancing, and there's also about 200 people sharing one washroom. They also said that their offices are still open, sales workers and administration workers are still in office on top of one another. So are you going to add that to the list of places that perhaps should follow social distancing and close up?
Well, I'll follow the advice of the Chief Medical Officer of Health, the Minister of Health, and the COVID-19 command table in saying that. We addressed this issue with the Minister of Labour. He was on a conference call with all labor heads of labor unions in the construction trade. They emphasized, every one of them, they want to keep the job sites open. In saying that, they said any worker that isn't feeling well, that's under the weather, they've asked to go home, isolate for 14 days. But again, we're going to go job site by job site as per their request, not ours. So if they feel that job site shouldn't be opened, they all guaranteed us they will close that job site, and we'll just play it day by day. But again, we consulted with every labor organization in this province. Thank you.
And we're seeing lineups at stores where the lines are easily 200, 250 people. Is the province going to consider asking stores to maybe limit how many people can go into a store at once to, again, practice social distancing? Because right now, there's not a lot in some grocery stores.
That's a very, very good question. I've talked to the 6 largest retail chains in the country, talked to all the CEOs. Matter of fact, we're doing a conference tomorrow, and we're going to be discussing that issue. We're also going to be discussing the supply chain, making sure the supply chain stays open. It's absolutely critical That was my conversation late last night with Ambassador Lighthizer. He guaranteed me that we're going to keep the supply chain open going across the border. But we'll have that discussion, and tomorrow when I brief the press, I'd be more than happy to tell you what the conversation took place. But it was a great question. I can't stress it enough. We have to keep the supply chain open. Nothing seems to panic people more than going into a retail store and shelves are empty. I still can't get my head around this toilet paper situation. Neither can the tissue companies. I've talked to Robert Irving from Irving Tissue off the 400 there. He said he has plenty supply. He has plenty of pulp. And for all the years he's been in the business, and all the retailers I've talked to just can't figure this out. So, and I think another discussion we should have, do we limit certain buys? You know how they have a sale, you can only buy two? Well, maybe I think we should start doing that with healthcare items. But that's, again, going to be up to the retailers. Thank you.
Hi, Premier. This question is actually for Minister Elliott, if you don't mind. Minister Elliott, you're well aware, obviously, you've tweeted about this, about the issues with telehealth. I understand you added an extra 300 lines this morning. You're well aware that there are still technical issues. We continue to hear from people that it takes hours to get through. When they get through, they're put on hold, then disconnected. This is a state of emergency here in this province. Why are people continually to be challenged by getting this information? And I want to point out, of course, to our viewers that are watching, on the Government of Ontario's website, the first point of contact, as per the government's recommendation, if you have symptoms, is telehealth. So people aren't able to get through. What more will your government be doing?
Well, we did actively add 300 more lines this morning. We are having a few issues with telehealth right now. We are actively working with the provider to remedy that, because we know that is the first point of contact for many people. We hope to have it up and running again very soon. And we are, of course, working to limit the timelines within which people have to wait to voice their concerns or their issues, so that they know where to go next if they need further treatment, or perhaps their concerns can be alleviated after the call. But we are actively working on that right now.
I want to ask you about the man who passed yesterday, who tested positive for COVID-19. Do you have an update, or when do you anticipate that you will receive an update from the coroner as to if the cause of his death was COVID-19?
Yes, as you know, we did ask the coroner's office for assistance in investigating this situation to see with this person who passed away and was diagnosed post-death with COVID-19, whether he died because of COVID-19 or with it. We have not been updated as yet by the coroner's office, and we'll certainly let you know as soon as we do.
Hi, Minister Elliott, as well. More questions for you regarding testing. The Premier said upwards of close to 2,000 tests were being done a day. That isn't quite clear from the math of the number of test results we're getting. So can you clarify how many actual test results are being produced every day? When are we going to, are the labs going to get to this stage that you say they can process 5,000 tests a day? Because the numbers that are out now show that there's about 3,600 people who are currently under investigation, and there's a 4-day turnaround time. That's an awful long time for people to have to wait for test results.
Yes, we are increasing both our testing capacity as well as our lab capacity. Right now, in addition to the original lab that we had to test the results, we also have some labs at hospitals which we collect on a daily basis so that we can provide all of you with the current updates. Right now, we do have about 2,000 tests that they're still pending. We're working through those as quickly as possible, because I know there are many people that need to know whether they are testing positive or not. If not, they can then proceed with their daily lives. If they are, then of course then they need to continue in self-isolation or may need further treatment. So we're very aware of the need to increase our capacity for testing, and we're working on that diligently right now.
Okay, if I can follow up on that. What do you say to people who are now having to endure a 4-day wait to get their test results? And why was the lab capacity not upgraded sooner to meet this demand?
Well, the number of people coming forward, of course, in light of world events, has come forward significantly. We have ramped up our lab capacity as significantly as possible, and we'll do more as we need to. The events are quickly evolving, and so we are trying to get the test results back in a sooner period of time. I agree with you, a 4-day wait is not acceptable, and so we are working on doing much better than that, and I anticipate that we will be caught up very shortly with the lab tests. So thank you.
Okay, Minister Elliott might want to stay up there.
All right.
I just wanted to follow up on Mike's question, because yesterday when we were at the briefing with Dr. Williams and Dr. Yaffe, the backlog was about 1,600 cases. Today the backlog is like more than double that, 3,600. So that indicates, I think, a bigger problem than you're letting on.
Well, it indicates that there's more and more people that are coming forward to be tested, and I think that is reflective of what's happening in the rest of the world. People are seeing what's happening in European countries. They're seeing what's happening in the United States, where they're being fully pushed to their capacity limits, even in places like New York, which are not backwards by any means. So we have more people coming forward for tests, which is good, but that means we have to respond with the lab capability, and we're working on that right now.
Okay, and I also, just as a follow-up, I wanted to get back to the healthcare workers and self-isolating, because I saw a memo to staff from a major hospital group earlier this week that said its healthcare workers were expected to show up for work even after, right after coming back from foreign travel. So you're saying today that has changed, and when did that change? And have you issued a directive?
That has been a very recent subject of conversation at the health command table, because we know that there are many people that are concerned about that. There are many other healthcare workers. I know there are many nurses that are concerned about that, and we need to apply the best scientific evidence and best practices to everyone. You can't have a separate category for healthcare workers. It is what it is. The isolation period is 14 days. It needs to apply to everyone.
Okay, did that go out yesterday or today, or when did that go out?
That is something that has just been discussed and will be going out shortly.
Hi, Minister. This is for you as well. South Korea seems to have set the gold standard for testing, and they've really reduced the number of cases because of their very efficient testing. You said 4 days is not acceptable. What is the acceptable guideline for lab results to come back? What are you hoping to achieve, and how long is it going to take you to be able to achieve that goal?
Well, I can't give you exact statements, but I can tell you 4 days is too long. Certainly with 24 to 48 hours is what we are certainly aiming for. That is what we would all like to see. We are in a rapidly evolving time, however, and so we are working on expanding our capacity. You're right that South Korea has done a really exemplary job. We have followed some of their practices in setting up the assessment centers as we have, separate and apart from hospital emergency departments, and having some drive-through centers as well. I think there are some good examples. We want to follow the best practices worldwide, and so we're watching what South Korea is doing, and we're implementing our own policies here in Ontario, where we have a different situation with many people who live in more rural areas, more remote areas, making sure that we can get everyone tested that needs to be tested.
And if we look at Italy, because that's set a horrifying vision for all of what can go so terribly wrong, one of their main problems is the lack of ventilators. So how many ventilators do we have here in Ontario per hospital across the province, and how many do you think we need if these cases multiply?
Well, we certainly have an adequate supply for what we're dealing with right now. That said, we have ordered 300 more ventilators that we will be receiving shortly, and as the Premier indicated, that there are auto parts manufacturers right now that are looking to retool some of the work that they're doing so that they can help produce ventilators here in Ontario as well. So many Ontarians, both in terms of individuals and corporations, are really stepping up to help us with both ventilators and other personal protective equipment. We know that with many borders shutting down, we need to find our own sources internally, and people are stepping up in Ontario. We're very grateful for that and very proud of Ontarians.
Next question.
This is for the health minister. Just following up on the telehealth question earlier. Have you identified the problem first? And secondly, are you confident that people will be able to get through and connect to speak with someone?
Yes. We expect that the problem has been the addition of the 300 lines that came on today. However, that is being actively investigated right now. We know how important it is for people to be able to connect with someone on telehealth to discuss their personal health situation. And so we hope to have it up and running again very soon.
And is there anything else you will be doing to ensure people are able to connect other than limiting the amount of time someone spends on the line?
Well, certainly people can go to the website, ontario.ca/coronavirus. They can do the self-assessment. There are questions there that people can answer themselves. If they remain concerned, they can always call their public health unit for information and guidance about whether they should be tested or not. Or they can call their family physician, who they're now able to provide virtual visits via telephone conference as well. So telehealth is not the only answer. There are other ways that one can pursue your line of questioning about your own health or a loved one's health. But we hope to have telehealth up running very soon because it is an important part of the system.
Do you have an ETA?
We are hoping imminently.
While health is people's primary concern, a lot of people are expressing anxiety about their savings, their retirement savings, even their jobs. How much do you think your government or any government can buffer people from the economic fallout of this crisis?
Well, I'll just answer part of it, then I'll ask Minister Phillips perhaps to answer the rest of it. We are certainly aware of the mental health concerns of many Ontarians, that are some of them who are going through self-isolation, who are experiencing feelings of depression or anxiety, and then other people who are worried about job security. How are they going to feed their family and make the monthly payments that they need to make? We are ramping up our mental health responsiveness to deal with that situation, but I will defer the economic answer to Minister Phillips.
So, Antonella, as you and as people in Ontario know, this is an unprecedented situation, and it is absolutely putting stress on families, putting stress on workers and on employers. I think what the federal government did today was a very good indication of just how unprecedented this is in terms of an unprecedented response, both in terms of the $27 billion of direct support and the $55 billion of tax deferral. Obviously, the objective, there is a health problem underlying the economic problem. And economic problems inevitably come down to confidence. And so the confidence of investors and the confidence of individuals is linked to the progress we make on the health front. And that's why it's so important that people respond. And I agree with the Premier and the Minister of Health. They have been to the request to socially isolate, to the request to be responsible, to wash their hands. All of those elements are part of the strategy. And it's a strategy that's worked around the world where we've seen things work, which is to try to flatten the curve of this. But this will be with us for a while. We will present our perspective from an economic point of view next week. And obviously we're watching day in, day out. I'll say things like today's injection of stimulus by the federal government are positives, but they're offsetting, a global health pandemic. So I think Ontarians need to know that their governments will do everything that is possible, but we also are part of a global economy. We are learning what the best approaches are, and fundamentally, this economic issue has a underlying health issue. So what we can all do to make things better is focus on the advice we've gotten: wash our hands and socially isolate.
Yours is a government, though, came to power with very specific fiscal goals. Can we take it that next week you will be releasing a document that has spending increases as we saw in the federal government today?
We absolutely are going to make sure that the dollars are there to support healthcare and make sure that the health system is strong and that public health is supported and that we're supporting people and jobs. We're fortunate that the actions that this government took over its first 20 months put us on a strong financial footing. But we will always be good stewards of the taxpayers' dollar, but the priority today is the health and safety of the economy and individuals. And so our statement will reflect that, and we will spend the money that's necessary to make sure those things are protected.
Okay, we're going to move to the phone line. I apologize in advance. We won't be able to get to everyone, but we'll take first question from the phone.
Your question comes from Travis Dunrush from Global News. Please go ahead.
Good afternoon, Premier and Minister.
Hi, Travis.
Two questions. One to follow up on what my colleagues have asked on testing. So the Director General of the World Health Organization says that the key to containment is testing. So if that is the case, why are people who fit the criteria for testing and exhibiting symptoms being refused a test? And how can we have confidence in the numbers coming from the government if that is the case?
Well, you're right, Travis. The key to containment is testing. But I believe that with the announcement that we made yesterday that we have moved to a state of emergency in Ontario, and the health measures that we have brought forward in closing bars and restaurants and so on, indicates that we are having to take a step forward from that. We know that there are only so many supplies available. That's a well-known situation worldwide. Canada isn't any different, and Ontario isn't any different. So we are taking all the steps that we're able to take, but we have moved to another level in Ontario, and we need to make sure that our vulnerable populations are protected, people in long-term care homes, children, and young people. We're encouraging them not to get together in large gatherings either, because the evidence is now suggesting that young people can be as easily subjected to severe illness as older people can be. So we need to make sure that we all take the necessary steps that we need to take. We have a responsibility to ourselves to protect our own health, but we also have a responsibility to our fellow Ontarians to make sure that we don't expose anyone else to the COVID-19 when it's avoidable. And with many social gatherings still happening, we're really asking people to please obey the rules. We owe it to each other.
So I have another question, but just as a follow-up to this one. So you're aware, though, that some people with symptoms are being refused a test?
What we're asking people to do in those situations, of course, is to self-isolate. They are in touch with their local public health units. The public health units will advise them if they continue to have symptoms after the 14 days of self-isolation. They will then be either referred if their symptoms are worsening, or they will be advised to continue the self-isolation until their symptoms go away, have resolved.
Okay, next question.
Next question comes from Victoria Gibson from iPolitics. Please go ahead.
Hi, Premier. I know you've been speaking with the Deputy Prime Minister in the last few days about the outbreak, and I'm wondering, has she spoken to you about the potential of Ottawa using the Emergencies Act? And if so, what was the nature of that conversation, and what message did you convey to her?
Just on that one part, I didn't hear the last part, and I apologize. Can you just repeat that?
No problem. Has the Deputy Prime Minister spoken to you about the potential of Ottawa using the Federal Emergencies Act, and what did you say, if so?
No, that conversation didn't come up with the Deputy Prime Minister. We've been in full communication back and forth, sometimes numerous times a day, but no, that didn't come up. It was mostly about last night it was about the border and other areas from some agriculture items, trucking issues, economic issues.
Thank you.
Thank you so much.
A question maybe for Minister Elliott. Are there any confirmed cases of COVID-19 affecting the Sudbury employee that have come up in the public service or within the government?
No, we're following that very closely. That's why the arrangements have already been made for people in the public service to work from home as much as possible. Within my own office, we have just key staff members there physically on a daily basis because, again, we want people to maintain that social distance as much as possible.
Next question.
The next question comes from Bill Kingston from Cornwall Newswatch. Please go ahead.
Good afternoon, Mr. Premier.
Hi, Bill.
I'm looking for some clarification on your order yesterday morning on closures. As we understand it, bars and restaurants were ordered to close immediately, but drive-through and takeout options were allowed to continue.
That's correct.
Crowds of 50 or more were not permitted. A downtown Cornwall bar had between 30 and 50 people in it last night celebrating St. Patrick's Day, and none of the patrons inside were practicing social distancing. Would this have been allowed under any circumstances, and what are your thoughts on this taking place in a medium-sized Ontario city?
Well, I'd be really disappointed that the owner would be that careless and reckless. This is all about communities, all 444 municipalities working together. The vast majority, and I'm saying the vast majority of people are following the order, and we thank them for that. This is the only way we can control the spread and flatten the curve, as they say. We need the cooperation. And I think that was very unfortunate. Someone would go down that road. And hopefully that won't happen again.
And just as a follow-up, just to be clear, your order that you issued yesterday morning was immediate.
It was immediate from the time we announced it, moving forward, and again, right across the province, we're relying on responsible residents of this province to follow the order, and again, 99% of people are following it. You just have to go down Bay Street, go down any of the major intersections here, and there's very few people out and about. But I just want to thank the people of Ontario because we're all in it together, and we're going to get out of it together. But that's really, really disappointing. They would do that. We'll keep an eye on that.
Okay, we have time for two more. Next question.
Thank you, Bill.
Next question comes from John McGrath from TVO. Please go ahead.
Good afternoon. Two questions. One, under the emergency, the state of emergency that you declared yesterday, the government has the power to fix prices. With all the reports we've been hearing about people hoarding and some people trying to resell goods at, extortionate prices, is the government considering any kind of price fixes?
Well, we're on this. Minister of Government Services talked to the minister. She'll be monitoring all of any price gouging. And I think these people are going to be held accountable on social media. And when we get over it, because we are going to get over this, they'll be held accountable by the people of Ontario. But the government will hold them accountable as well. And again, it's really unfortunate. I had a guarantee from the 6 large CEO, the large retailers, all the CEOs, saying that's not going to happen. Matter of fact, to the opposite. They've offered help. I'll give you one large retailer offered their phone bank to help out, and we appreciate it. But we need trained nurses and to get on those phones. They've offered all sorts of different support. They've offered their pharmacists up. I'm so impressed with the business community here in Ontario stepping up to the plate. As Minister Elliott mentioned about the auto part manufacturers, got off the phone with the president of the association. One of the companies have a line that they'll take down and start producing whatever we want, be it ventilators or respirators, and they have 400 people ready to go. This is what I'm talking about, the spirit of Ontario, the spirit of the people, the spirit of the businesses. This is how we're going to get through this.
And just a quick follow-up. We're already seeing reports of major declines in transit ridership. This is going to affect the finances of both, Metrolinx and GO and the TTC. Is the government prepared to bail out transit operators in the province?
Well, we're prepared to support Metrolinx and the TTC. I'm in constant conversations with Mayor Tory, again, twice, 3 times a day. We're all being collaborative, all 3 levels of government. We've said right from day one, we will do what it takes to make sure we take care of the people of Ontario's health and Ontario businesses. And we're working hand in hand with the federal government to make sure we don't duplicate the resources. They understand the lane they're going down, and we're going to complement that with another area that we're going to focus on. But we're going to work together, and I'm very grateful for the leadership of Deputy Prime Minister Freeland and Prime Minister Trudeau, along with regional mayors of large cities across this province and the small mayor communities as well. We're all working together, and I'm very, very grateful for their collaboration with the province here.
Okay, this will be the last question from the phone line.
The next question comes from Sabrina Nanji from Queen's Park Today. Please go ahead.
Oh, hi, Premier and Ministers. My question is for Minister Phil. I know you can't give away too many details for next week's fiscal outlook, but I'm wondering if and why it will be tabled in the legislature. Like, for instance, will it come with a corresponding bill with tax changes?
The House Leader is in discussions with the opposition at this moment about how we'll proceed, but we would like to and think it's important, because this is addressing a public health emergency, that where we need access to legislation, as we do tomorrow with the work being done in the Labour Bill, for example, that can be a part of it. So, of course, that's part of the conversations that he's having right now, but that is why the legislature is where it'll be introduced.
Okay, and just to follow up, can you clarify your earlier comments? Will Ontario be following the feds and putting a moratorium on OSAP and student loan repayments?
Yeah, we are going to be coordinating in a number of areas. That's one of the areas where we've been in discussion with them and where we will be aligning. So they put a 6-month moratorium. We'll be doing that as well. And as the Premier mentioned, the objective here is to make it as easy. This is a difficult time for people, so we want to make it as easy as possible for the people that the assistance is aimed at. And that is one of the areas where we can quite easily collaborate.
Okay, we just have one last question here from Cynthia.
Hi, Minister Elliott. This is just a clarification. When you were asked about testing, you said that you're seeing that young people are just as susceptible as older people. But can we clarify this? Are they getting as sick as older people? Because up to now, we thought that they weren't.
They don't appear to have been. They seem to be more carriers and transmitting it to other people, although we are now seeing scenarios where young people who are in their 30s are now becoming very ill and are having to be placed on ventilators. So this is a very, very serious health situation for all Ontarians right now.
And you're seeing that in Ontario or across the country or around the world?
We're seeing that certainly across Ontario. We're also seeing it in places like the United States, in New York, for example. A very significant increase in cases. They are finding their health system is being severely overburdened right now. We don't want to get to that situation in Ontario. That's why we're really asking people to take this seriously. Please demonstrate the social distancing as much as possible, and don't gather in crowds.
Thank you, everybody.
Thank you. Thank you, everyone.